If you have a question for Dr. Donna, please do leave it on my page and I will be happy to answer the question for you.
Thank you so much. This is a very illustrious panel of speakers, physicians, advocates, activists in our community. It's been almost a year now that we've been dealing with this pandemic, and we've hit, unfortunately, a grim milestone in 500,000 people who have died from this virus. Just to give you guys perspective, that is more than the entire population of Oakland. Imagine if the entire population of Oakland died instantly. That's how many people we've lost. And in that, we've seen frank disparities in who's getting COVID, who's being hospitalized with COVID, and who's dying of COVID. So I'd like to ask to our panelists, especially, why are communities of color being disproportionately affected by COVID-19?
Go ahead, Noha. You go first, A.
I know we can all answer this question to varying degrees of specificity, probably. Yes. I mean, it starts with what we all already know, right, about structural inequities. And so I think any one of us, if you would have asked us at the onset of the pandemic to predict whether there would be disparities, I think we sadly would have predicted the disparities that have come about. I think as it relates to this particular virus, there's a lot of things we don't understand still. We really don't know all of the reasons why, for instance, African Americans are dying at double the rate, and in some areas of the country, even more than that. I think that there's a lot of hypotheses, but I think we still have a lot of work to do to truly understand. But in general, I would say that it's very strongly correlated with poverty, with crowded living environments, with being essential workers on the front lines in many industries that did not have great workplace protections before the pandemic. And now that's being revealed even more. Folks who are living in multi-generational households, utilizing public transportation, and in living in areas that are historically sort of redlined and have faced a lot of just all of the structural issues that we know lead to a number of other health disparities, and this one is no exception.
I would only add that what Noha touched on initially, which is the mistrust and distrust and unconscious or overt bias within our medical system. I have a family friend, in our communities. If you grow up with someone, they're your cousin. So one of my lifelong cousins who's attended family reunions since I was 12 died 3 days ago of COVID. And that, I think, was related to everything that we're talking about: waiting to go to the hospital, not being comfortable seeking medical care for mistrust in our culture, and then what judgment and bias occurs when you see someone who looks like us when you interface with the medical system, as well as education and culturally relatable providers. So Dr. Donna, I'm sure, can elaborate on that, but the need to have the cultural relatability and information in a palatable way, make it plain so people understand why they should be masking, when they should seek care. So it's simple and plain and digestible.
Yeah, and I would just add, it's I don't think it was any surprise, like Dr. Noha said, that we figured Black and Brown communities would be disproportionately impacted by this virus, because we are disproportionately impacted in so many other chronic disease areas. And that is a result of, many years of systemic racism, of medical and scientific racism, of, environmental racism. I mean, you name it. There's so many ways in which our communities have been negatively impacted by environment, by systems, by the medical system. And so that when the virus hit, it just highlighted the inequities that were already present.
Thank you all for that. You guys have all touched on some important issues around the, I guess, what we learn in medical school or don't learn in medical school, social determinants of health. And one thing that, is often kind of brought up in the news around kind of the inequity we see around the pandemic is whether Black or brown communities are inherently more susceptible if there's a genetic predisposition. Can you guys speak on that? If there's anything that you know about as it relates to that idea?
That we're genetically inferior? Well, I think we have heard that many times before, but there have been no scientific basis for the claims that we are genetically really different. I think the differences, as we kind of alluded to in the beginning, lies in practices and systems that have been put in place to not protect us and to not allow us to have equitable access to care, to have equitable care. And representation really matters. Who is treating you? Who is giving you the information? If they don't look like you, it's a lot more difficult to trust what is being said, what is being told, and to quite honestly, to even care about delivering the message if you don't have a connection to the community. So I think those things play a part much more than anything genetic.
Yeah, I think what Dr. Noha said initially about poverty, what I've learned a lot in my current role with COVID testing for our county and looking at that data is the poverty piece and back to the social determinants of health. Early on, when people were getting it, they were told, oh, you got to go isolate. Well, how are you going to isolate when 8 people live in a 2-bedroom apartment and everyone is mom speaking? Those are the little pieces that as clinicians, we have to go further and have a holistic approach to treating the patient in front of you, because that patient is tied to family and friends and day laborers and essential workers. So I think it's a pivotal time for healthcare to change the way they approach the patient and have a holistic view. I think that's been the biggest piece for me.
Yeah, the only thing I would add, and I definitely agree with everything that's been said already, but the one thing I would say in terms of the sort of the biologic piece, or is there something there, is I remember when this first started, hearing that hypertension was a risk factor for poor outcomes and thinking, this is unfair, and why is this happening? Because we've never seen that in terms of an infectious disease, right? Diabetes, yes. Cancer, yes. But what is going on with hypertension? And I think we've learned a lot more that this is not exactly a respiratory infection as much as it is really an inflammatory condition that's overtaking the entire body. So there's a correlation there. But knowing the prevalence of hypertension, sometimes more difficult to control, particularly with African-American men, and affecting younger men, I would say. So there's something there. I don't know, it's definitely related to all of the other things around social determinants, access to care, and all of those other things as well. But that was one thing that struck me as, okay, we're in for, some disparities just on that point alone.
Right.
Let's get your thoughts. Can the vaccine be trusted since it was developed so rapidly?
I want to know who your audience is. I think there's population bias. Are they all clinicians and informed?
They have to be.
They don't represent Alameda County. They don't represent.
This is great. We're done here.
But the good thing is that most feel that they can trust it. And frankly, as a Black woman from San Francisco, my family's from the Hunters Point Bayview. Even though I have a little bit of medical knowledge, I was hesitant and not the first in line. I wanted to research it myself. I wanted to see if they tested it in African Americans and Africans and Afro-Caribbeans, everybody from the diaspora, who was represented in this and what were the side effects. So I had to talk to immunologists, etc. And but I was happy that up to 10% in Moderna and Pfizer were Black of the African diaspora in both of those studies. And I did more research on messenger RNA because I was ignorant into what is this messenger RNA? And is this going to affect my DNA? Is this going into my cells? Sometimes when you have too much knowledge, it makes you crazy. So I was, and then I got educated on that and felt much better when I saw, well, oh, this is the same technology they use for the Ebola vaccine and the Zika vaccine. It's actually been around for a few years. So they have a few years of data. And I just equate it to, you know, those home improvement shows, and you have a house project that takes you 2 years, and then you watch and they build a whole house in 6 weeks because they bring all of these resources. That's how it was with the vaccine, because it was a global pandemic. World Health Organization and all the countries dumped billions of dollars into developing this resource that we all needed. So I wasn't too worried about how they did it, but the data and ensuring that it would be effective in myself and my family, my community was my initial caution.
Yeah, my journey sounds really similar to Dr. Garrick's. Just going from, okay, I'm going to wait. At one point, I say I'm going to wait until 3 million people get it. That was my number for, you know, scientific or not. You know, you just want to know that there's a critical mass and see what's happening. Definitely, you know, brought in vaccinology experts to talk to all of our providers at Roots. And we just grilled folks and asked all the questions we had. And, you know, it wasn't enough to say like, no, it can't change your DNA. Okay, why can't it change our DNA? What is it? Okay, it can't get into the nucleus of the cell. So there's really no actual way it could change the DNA, right? And so just really trying to get to more nuanced answers to the questions, because for me, the question isn't even, can I trust it or not? Because, you know, trust is one of those, is a relative thing, right? It's actually more like, what are the risks and benefits of doing it? And what are the risks and benefits of not doing it? That's actually the question for me. And so that was the question that I sought to answer for myself. And so when I really looked at, okay, now millions of people have gotten it. There have been no deaths associated with actually getting it. Yet if you catch COVID, you know, your risk of dying is about 1 in 60 in this country. And that's on average. That's not if you're in a higher risk category. And that is not a good number. So, you know, so those are kind of some of the different calculations that I did. But I did the same thing as Dr. Garrick, dug up old mRNA vaccine trials, phase 1 and 2 trials from, you know, SARS vaccines, and really tried to understand how they were able to do it so rapidly. And to Dr. Garrick's point, you know, when you remove the financial risk for companies as large as the ones that have made these, then they had guarantees on their work. They were actually able to go into production before approval. That is unheard of. I mean, that nobody would produce a bunch of stuff that they might have to throw away if it doesn't get approved, right? But because they were totally backed with pre-orders and all of that, you know, it removed the risk. And so instead of having to do step 1, 2, 3, 4 consecutively, they were able to run all those processes simultaneously. So me getting an understanding of that, like the logistics of that, helped me understand that there were not corners cut in that process.
Yeah, and also just knowing, you know, this virus, I call it the ratchet cousin in the coronavirus family, right? Like, you know, you all have this family, you have these cousins, and they're all you're kind of similar because you share some DNA, but then you have that one who's just way out there. Is unpredictable. You don't know what she's going to do. You can't take them anywhere. And so to me, that's kind of how, you know, coronavirus, you know, this 19 is like, it's the ratchet member of the coronavirus family. But really early on in the pandemic, someone who's really close to us in our family died. She was only 43 years old. And so that kind of shook me. And so when the prospect of a vaccine came on the horizon, I was a lot more open to listening to what it was, because I had lost, by that time, I had lost 3 people to coronavirus that were very close to me. And then also, you know, as you heard in my bio, my husband and I pastor a church. So I had church members who were coming to me who I knew had, you know, some of the conditions that put them at higher risk for not only contracting coronavirus, but potentially dying from coronavirus. So I felt this tremendous amount of responsibility to really figure out what was going on with these vaccines, and to get myself ready to either take it or not take it, and have a really good reason why I wasn't, you know, whichever way I was going to go. And so just, you know, we're all doctors, we're going to do our research. So we all did our, you know, I did my research, I looked into it, I read a lot, did a lot of YouTube videos, saw the virologist at UC San Diego and UC Davis, and really just kind of tried to understand you know, the process that why we got here, how we got here to this vaccine, you know, again, recognizing that this, you know, cousins to this present day coronavirus have been in existence for many, many years. And so they had a head start. They already knew that the spike protein was really, really important. That was, you know, that was part of the 15 or so years of looking at coronavirus as a family. And then also, you know, being able to advances in our genomic studies, right? Being able to say exactly what the genome is of the virus, like being able to, that was groundbreaking that we were able to do that in other ways. And so when the coronavirus came, it's like, oh, that was simple and easy and quick to do. And then the other piece was they just cut all of that bureaucratic red tape that we all hate, right? Like instead of being able to walk across the hall and just hand someone a piece of paper, we have to walk down the hall to hand it to the person who reads it, and then they hand it to somebody else and they walk it across and give it back to you, and then you walk across the hallway and give it to that person. Those 20 steps, they just cut all of that and just said, go walk across the hall and hand them this information. So all of that was really pivotal in making us be able to have a vaccine so quickly.
Thank you.
Only
Thank
thing
you
I
for
would
those
just add
responses.
maybe, oh, sorry. I was just going to
Go
add
ahead,
briefly
Noha,
that,
sorry.
you know, I do think it's important to acknowledge the situation, right? Is that I'm sure we would all love 5 years of safety data and efficacy data and know how long it's going to last and be able to answer all those questions. So there is a piece that says, okay, we're going to have to accept that there's some things that we're just not going to know until we know, but we need to know the most critical thing, which is that it's safe. And secondly, that it's probably the only way out. And then how long it lasts and those kind of things still remain to be seen. And so we're going to be keeping like a laser focused eye on that information. But I did just want to acknowledge that, because this is not by any means a perfect situation. We are having to accept that we don't have as much long-term data as we would want, but we also can't afford to wait.
A ton of misinformation that has been propagated through social media, you know, through the news, unfortunately, as well, and just, you know, peer to peer. I think it'd be good to kind of address some of these myths on this forum. You know, one of the questions that I get, and maybe you've gotten, is that the vaccine is going to affect my fertility. What do you guys say to that?
The pediatrician is definitely not going first on this one. Although I do have a comment on it. So since I'm talking, I'll go ahead and say my comment, and then you adult docs can chime in. I think that in the Pfizer study, there were some people who got pregnant during the study. I don't think they meant to get pregnant, but they did. They had their babies, and at the sort of 2-month checkup, looked at their babies and saw, you know, their babies are fine. So I think pregnancy seems to be okay. I think the American College of Obstetrics and Gynecology has endorsed for pregnant women to get the vaccine. So from the pregnancy standpoint, I think most people think that it's safe, but I'm not as well versed in the fertility piece.
Well, my understanding, because I had to look, this is one of those perfect rumors to start if you want folks to not, to not do something. And so I did have to look into, and I'm going to forget the name of the protein now, but I did have to look into how this rumor got started. And it was a very tangential, that there's some protein that's in the placenta that's somewhat similar to some protein that, might get generated with so it was it just, there was not a straight line. And I'm sorry, I'm not going to be able to reiterate the entire myth back. It's probably a good thing. But, it seems to be being propagated by folks that have a particular agenda and has really no scientific basis to it at all. And so it's just really unfortunate that one has seems to have taken hold a little bit. But to Dr. Donna's point, I mean, at this point, there have been a whole bunch of babies born to people who received the vaccine, and people have gotten pregnant after they've gotten the vaccine, and there's no scientific basis of it being able to interfere with fertility at all. And so I think it really is just a myth that got started. And you know how the best myths are the ones that have, some little piece of something that sounds good, sounds scientific. Those are the best myths out there right now. And just like the it's nanotechnology. So that means it's a nano chip. So that means no. So it's like you have to go way back to very basic science classes to break some of these things down. And I know we're all pretty, exhausted with having to do that, but that's literally a big part of our job now, unfortunately.
Dr. Aboelata, to touch on that myth, I believe you were talking about the syncytial protein on the placenta. The myth was that the protein that's found on the placenta is a type of spike protein. So, spike has been the key word that a lot of people have been hearing. And the premise was that the spike protein on the placenta was going to be a similar protein that the vaccine can attack and then affect your ability to have a baby and, make you infertile. So people just ran with it. But that's not founded in any truth or any type of evidence. Assuming that you guys have all gotten your vaccine, because I assume all of you gotten your vaccine, even though I haven't specifically asked, what side effects did you feel personally, if any? Because a lot of people are concerned about, the immediate side effects as well as the long-term side effects of the vaccination.
Well, I can go. I received the Moderna, and after the first one, the next day I felt like I was walking through a fog, and I was heavy and tired, and I was like, what's wrong? I guess I really am 50 now. I'm just tired. Why do I feel like I need a nap? And I was told that if I felt fatigue and lethargy, that after the second dose, I would likely have more symptoms. So after the second dose, I had the muscle aches, fatigue, headache, joints, viral symptoms. And I did pre-medicate with Tylenol that morning and take Tylenol that evening. My symptoms lasted for a day and a half. And that second day when I woke up, I felt completely normal. But the evening I received the second dose, and that next day I was uncomfortable.
Yeah, I had similar experience. I also had the Moderna vaccine. On my first vaccine, I just had a little bit of soreness in my arm, and that was really it. I didn't feel anything at all. But that second dose, woo, yeah, that one kicked my butt. So the night after the vaccine, I got it in the morning. And so about 12 hours after I got the vaccine, I developed a headache and felt tired. So I went to sleep. And then the following day, I pretty much laid in bed the entire day, and I had chills. I had a low-grade fever, nausea, not like I wanted to throw up, but just the smell of food made me very nauseous. So I just sucked on the juice of oranges all day. My kids just kept bringing me oranges and peeling them for me, and I just sucking on the juice. And then around 3 a.m, I woke up because I was sort of cold, and I felt like someone had just poured a pail of water on me. I was just drenched. But then when I got up, to change my pajamas, I felt totally fine. Headache gone, nausea gone, fever gone, everything was gone. And then I felt totally fine.
I wonder, can you do a poll to see if anyone over 60 had symptoms? None of my aunts, healthcare workers I know, my parents were at the grocery store the next day.
That's so true. My mother-in-law was like, I didn't have anything, and she's 84, and I felt like such a wimp. Like,
editorial that the younger you are, stronger immune system, you have a stronger immune response to the vaccine.
Yeah. And I did take it as a great sign, right? Because with your first vaccine, your body is being introduced to these spike proteins, right? That your body is creating, and it's starting to line up your little soldiers, right? Your little antibodies. And then on the second time, these antibodies, they're waiting, ready, because now they remember that spike protein that was in the shot the first time. And now here they are in the second time, and your body's like lined up, ready to fight. And so I was actually happy to have a response, because I felt like that means my immune system is nice and strong. It recognized and it's working. It did what it was supposed to do. It was uncomfortable, but it was reassuring at the same time.
Yep. So I also had the Moderna. It sounds like we all three had the Moderna. The next day I was completely fine. And then the second day I had, for whatever reason, I had like very mild nausea, headache, and chills. So that it wasn't that pleasant. I stayed in bed like half the day, and then it was just gone. I will say I was not prepared for the arm pain. When they said arm pain, I just thought it was gonna be like a regular shot arm pain, but it really felt like I was socked in the arm for like 3 days maybe. And then it was just gone. And then my second dose was supposed to be today, but because, everyone is really saying the second one is worse and I have a very full day tomorrow, I moved it to tomorrow. So I will be giving it tomorrow at the end of the day. And, whatever, my weekend will probably be, I'm just prepared for it. But like Dr. Donna said, but I'm trying not to call them side effects, because they're actually anticipated reactions that we're sort of supposed to get to indicate that we are mounting the appropriate response. And so I am anticipating my anticipated effects.
Yeah. And in the nicest way, I hope they come.
Thanks.
Dr. Thomas, there was one question in the chat. Tila, do you want to ask your question? It's about the vaccine, so I just didn't want to move without her question getting asked. Oh, okay. I'll ask it for her.
I'll go ahead. It looks like the question was asked. We've gotten a lot of new reports about these variants, so to speak. The UK variant that emerged basically early in December, January, and then this South African variant. Two questions, I should say. Talk to us about what that even means. I think people hear that, but don't really have a really good understanding what they mean. They think it's just some mutant virus that is completely different, which it is, but in effect, it's not necessarily the same. And then the second question I have is that, at least that's been reported, is how does the vaccine protect you against these new strains of the virus?
Yeah, so I guess I could start. Viruses mutate. That's what they do. And when you have a virus in this situation with COVID that is basically infecting so many people and replicating so much, every replication is an opportunity for a mutation, which is really just an error as it is being transcribed each time. So it has been actually a slowly mutating virus, believe it or not, compared to like the flu, which as everyone knows, it rapidly changes, so that we need a whole entire new vaccine every single year. It has about 8 to 10 mutations every month. That's been the average that has been doing this whole time. And most of the mutations are irrelevant and don't make any change. But every now and then you're going to get one that kind of sticks or that makes it more effective at doing what it does. And that is what has happened with the UK variant, South African, Brazil, and now we have a homegrown one as well. And we may have others. The problem is that in this country, we don't really have a great strategy nationally for genomic surveillance. So we are only really sequencing, maybe 1% of samples. So we don't know what all is among us, and that is very concerning. But right now, the vaccine, it basically promotes a whole immune response in a variety of ways, right? And so you have antibodies, you have cellular immunity to multiple areas of the spike. And so even if there's some mutations, it's still looking like we will mount enough of a response. Now, is it going to be less? So are we going to, we've been spoiled, like Dr. Garrick said, with this 95%, we're thinking everything should be 95% now, and we are spoiled. No, most vaccines are not that effective. Will it be less than that? Yeah, that is very possible. Will we end up with strains that evade the vaccine completely? I think that question has to do a lot with how far ahead of this thing can we get, right? So if we get to a point of herd immunity, that means none of the strains will be able to circulate the way that they are now, and this won't be as big of an issue. I think the real concern is if we don't get enough people vaccinated, we don't get enough ahead of this pandemic, it will give more opportunities for these strains that may be more infectious, that are more infectious, they're more contagious. It will give them more opportunity to be able to spread. And I think that is really the big concern, and it is a big concern.
One question that was asked was, what's the best way to try to encourage people to get vaccinated when there's so much misinformation and mistrust in the community?
What Dr. Donna said, I think all of us probably say the same thing. It will prevent you from dying, and it will prevent you from getting really sick. And that's what you want, because you have children, you have parents, you have generations that we are responsible for as individuals, and you want to be here. They just released a study from Israel. I think it was 602,000 of the citizens in Israel. Of course, it's a small country, but they have the highest population that has been vaccinated for a country, and 21 people have died. So that's not zero, but it's 0.0002% of the 600,000 people. So that you can't discount that. That's amazing. And I know it's probably more homogeneous population, and maybe some of the DNA is, synchronous, and it doesn't have the diversity that we do, but that's a fact.
Yeah, I think, answering people's questions and concerns and pushing folks a little bit, in healthcare, I think, especially, I think we're all used to doing just a little bit of tough love and challenging people when they're bringing stuff that are myths. And we shouldn't be intimidated by all the amount of misinformation out there, but we need to be patient with people and understand that it's a lot to take in. Some of it is it's like math. It is math, right? To be able to do a mathematical calculation of what is my risk of getting COVID or doing poorly with COVID, what is my risk of something bad happening with the vaccine, we need to give people the tools that they need to make those calculations. And the one thing I hear the most is not so much, I'm never going to get it. It's, I'm just going to wait and see. And so I've been trying to challenge people a little bit. Well, what do you want to see? What are you waiting for? Are you waiting for 100 million doses, 200 million? What are you waiting to see? Because in the meantime, you need to be doing a great job of mitigating your risk. And I think that's the other piece, is having that real conversation about how at risk are you? If you're sitting at home all day, every day, and you never go out and you never see anyone, and you plan to just be like that for a while, then you're saying, I'm going to take my risk down to zero and wait and see, okay, that's one scenario. The other scenario is I'm just going to take my chances. That's not logical. So I think we need to urge people to be logical with what it is that they're saying and doing, and try not to be fear-based. And I think most of it is fear-based and unknown. And it is psychological, because you could say, I might not catch COVID. I'll go out and I just might not catch it. But if I proactively get the vaccine, I'm telling them to put something in me, right? Mm-hmm. And so people have to wrap their minds around that. What is my actual risk of getting COVID? This thing is circulating so rampantly. And a lot of people who get it are not sure exactly where they got it. They think they're being careful. Most of the people we talked to thought they were being pretty careful. And then they were around someone too long. They thought that, they thought they were taking the precaution, but they got it anyway. And so I would just say that, that really equipping people with the tools to do that mathematical comparison and to really answer their questions in a way that is patient and is calm and is respectful. I think we have to be respectful, because one of the things that has bothered me, and Dr. Donna touched on the performative nature of how we're going to try to convince people to do it. Oh, look, so-and-so got it. Obama got it. Kamala got it. Like, that don't insult me, please. Like, give me information. And so I think we have to be careful to not shame people, because I've seen a fair amount of that. And that's coming from a lot of people. Well, you need to go on and get it. When it's your turn, just go on and get it. And I understand, because I think we're worried, we're concerned, and we want, but paternalistic style of medicine, that's old. Medicine is a partnership. It's a relationship. It's a trusting thing. And just like we should avoid, in my opinion, labeling patients non-compliant, we should avoid calling people vaccine hesitant, because what that does is it puts the blame on that person, when really we have just as much as a responsibility, because it's a relationship. If you're non-compliant, maybe I didn't explain something well enough. Maybe I didn't make sure you were okay with it. Maybe I didn't ask you the right questions, right? So we as healthcare providers have to take on our part of the responsibility in the relationship to answer those questions and not label people as, oh, well, they're not going to do it. They want to be ignorant. They want to be whatever, and really meet people where they are with respect and without shaming people for their decision. And then the last thing I'll just say is that just because someone's not ready to do it now, I don't think we should help them cement the no. I think, and I've seen that happening. If you people will dig into their decision if they feel pushed, and if they feel shamed, and if they feel like they're being pressured. Nobody wants to feel pressured. So just because someone says no now, it's like, okay, well, what information do you need? What would help you, what information could help you make a better decision or a different decision or whatever. And then, you're always free to change your mind later, and I'll be here when you do, because the last thing you want to do is close the door to where someone doesn't feel free to come back and talk to you about it later.
And you have to acknowledge, we have to acknowledge where people are, right? And ask, where are you? What are your questions? Like in medicine, we have, see one, do one, teach one, right? And in this era, we have to have like, I hear it, I understand it, and then I amplify it, right? So everyone who's on this town hall tonight, if you've learned one fact, one thing, then you become an amplifier of that message and you share what you learn. And that's how we're going to spread the message, because your family and your friends trust you. So if you say something, they're going to believe it. And so as we get more information out into the community, the more of us who take that information, understand that information, and then share that information out, then the better off we all will be.
If you have a question for Dr. Donna, please do leave it on my page, and I will be happy to answer the question for you.